done, you lot.
Definitely, you've done a lot for me in the past. Good for you. Not especially you, but there you go. But you can keep that. It's on. Good luck, everybody. Well done. Oh, thank you. This is on the film as well.
You can get tomorrow. Just today, is it?
Do not pay to the floor.
5, 6, 7, 8.
Restore our pay, it's not too late.
6, 7, 8.
Restore our pay, it's not too late.
1, 2, 3, 4.
Do not pay to the floor.
Doctors are tired, they're frustrated, but ultimately we're terrified of the state of our healthcare service. Doctors, we're patients, and our families are patients. And we've seen the quality of care in our healthcare system decline over the years. We used to have real standards in this country. Patients used to be seen within A&E within 4 hours, and now you're lucky to be seen within 12. Last winter we had 500 avoidable deaths a week. That's like a Boeing jet of patients going down. It's completely unacceptable.
We're out on strike for the 11th time. Doctors are resolute in their pursuit for pay restoration. We're not asking for it all in one go. We're happy to talk about a journey. We're happy to talk about a multi-year pay deal, but we need a proper negotiating party to sit down with us, drop the rhetoric, drop their odd preconditions, and just negotiate in good faith.
Have a high number of doctors that actually drop out of training because the hours that we do.
So I work in obstetrics and gynecology, so I see a lot of women who come in, well, we're on the waiting list for routine procedures, and they're waiting for over a year for these treatments. What that means is they come into A&E repeatedly because they're unable to cope at home with pain or bleeding, and we are unable to treat them because the treatment that they need, there is a waiting list for over a year. So these patients are in pain, and it hurts us to see these patients come in again and again with the same problem that we know we could treat if we had enough doctors.
Protect our staff. We strive to protect our staff. No to trial.
No to 9 p.m.
No to trial.
No to 9 p.m.
I think the Conservative government are just wishing the whole thing away, and they're probably wishing everything away at the moment because their campaign has been so incompetent. And this is a message to whoever moves into the health ministry, whatever department takes it over next week. They've got to settle this straight away, and that will mean paying a lot more money and a commitment to guaranteeing those salary levels for the future. Otherwise, the huge numbers of people waiting for operations will simply increase as there will be fewer and fewer doctors and surgeons around, and the health service will get worse and worse. And with that, of course, creates a market in the private health sector for those that can afford to buy their way past the queue.
Yeah, that's all boosted and clarified. I think that the trust contacts you anyway if they need.